My name is Dr. Manon Bolliger, and in this webinar, I'll be sharing with you elements that will maximize and enhance your practice. So thank you, and we'll start. Starting with our patients. The patients that come to us make a choice. And if they get results, many will follow. The patients that make a choice in their health care tend to rather try something natural, have tried everything else, may actually be desperate, are in pain, have nowhere to turn, but want to get better and find their health. So what do we do as doctors or healthcare practitioners to help them? We talk about our tools, our magic little pills, our remedies, our herbs, our vitamins, our you name it. We talk about what we do, our modalities. We forget about the patient, their experiences, their objectives, which deep down is really to know whether they can heal, that their bodies can do it. Factors involved in healing are 3: agency, therapeutic relationship, and the ability to cope with stress. Agency is a sense of empowered decision making. It's really being aligned with why you're choosing to look after your health. And the therapeutic relationship really boils down to the clinician or doctor or practitioner holding the vision for the patient or client. And lastly, the ability to cope with stress is about their relationship to themselves, to others, and also the state of their autonomic nervous system. The problem for most patients is that they are utterly confused. We tell them what we do, but we really don't give them an opportunity to experience their own body to heal. The problem is that all the things we do are so confusing to our patients. They're wondering whether their own thoughts are actually killing them, and or whether it's maybe their emotions. And they're wondering in the back of their mind whether maybe just one more time Big Pharma has something to offer. They are firing in too many directions. Basically, they're not sure where to start. They are discombobulated and they need grounding. So what I often tell people is that it's like the analogy of a computer where we have so many programs going at once that the body is utterly confused, and maybe the best thing to do is actually to shut it down and restart. And this is what I call the rebooting your body. So why do you reboot your body? Because, for one, your body systems also go haywire and need a chance to refresh, reset, and reboot. You reboot when you're all stressed out. Also when you're in pain, because pain demands your full attention. And with pain loops, something's got to stop them. And it's actually the autonomic nervous system that really helps to modulate pain. When you're in pain, you aren't interested in anything else until you get out of pain. So why do we need to reboot? Well, you need to restore your body, you need your sleep, you need your energy, you need better circulation, you need better elimination. Rebooting your body is one of the most transformational approaches to healing. Rebooting your body positions you to initiate healing. And rebooting your body enhances all therapeutic interventions as the body is primed for healing. the importance of the connection to the body. And I want to stress this because many times the types of therapies we offer are verbal, they're intellectual, they're definitely effective, but there's no touch component. And in my experience, not only is healing in relation to another, touch is also a fundamental contact. And why is the body so important? Because the body stores memory in its tissues. Because the body and mind are completely inseparable. And what affects one must affect the other. That is why gentle touch that prompts the body is so powerful and such a great door into the healing process. The greatest healing tool, you all know it, it's the body itself. And BowenFIrst catalyzes the healing response of the body, accelerating it without interfering with it. It summons the body's ability to integrate new states of repair into its restorative network. BowenFIrst helps integrate the separated part of the body due to trauma, injuries, or repetitive strain to rewire with the rest of the body. BowenFIrst allows the body to reboot itself. BowenFIrst restores parasympathetic function, and they can directly relieve these symptoms through reducing sympathetically maintained muscle contraction. Spasm and inflammation, which are normally like healthy, normal, immediate responses to an injury, often remain long after and become the problem. The parasympathetic portion is reciprocally restored, increasing blood and lymph flow, feeding undernourished tissue, and reducing inflammation. This is why it is so useful for all kinds of musculoskeletal pain. It also facilitates pain elimination. The objective in BowenFIrst is to remove held patterns of pain and physiological dysfunction by restoring the structural integrity of the body. BowenFIrst is a process that enables self-regulation. Pain is the result not only of an original cause, but of the many defensive posturing the body takes to compensate for the original injury. The key is to untangle this pain web of compensatory feedback loops. You can feel shifts in your body during and after BowenFIrst sessions, which connects you to your own body resources and magnificence. You might use BowenFIrst just to clean the slate. All therapeutic interventions are magnified after BowenFIrst. It's like cleaning the slate and preparing the body for proper nutrition, effective therapy, and more profound and longer lasting effects from remedies. It is a simple and profound way to connect to the healing potential alive in all of us. BowenFIrst, a non-invasive pain elimination tool, has turned into one of the most powerful empowerment and alignment experiences for my patients. The transformation they experience engages them with anything else I do because they trust their own bodies to heal. And that is so fundamental. So the question is, are you rebooting your body? Are you increasing circulation, lymphatic flow, facilitating detox pathways, increasing elimination, integrating and harmonizing your metabolism, resetting your autonomic nervous system, and shedding old emotional patterns from your tissues? Watch this video.
Hi, I'm Julie, and I came into the clinic a week ago for my first treatment. I woke up one day and could not walk. The pain was so bad in my back. I had been training to do a half marathon, and I guess I just kept making the problem worse instead of kind of listening to my body. So I had two friends tell me about Minot, and I was actually looking at it for a family member who's having some issues, but then the more I thought about it, the more I thought, well, I'm going to give it a try. And I'm really glad that these were two women that I really respected, that I knew were into fads and things like that, because they told me that it would be unlike anything I'd ever done before, and they were right. It was amazing because as of a week ago, I hadn't had more than 2 hours sleep. I was in so much pain and I was tired. And then after Minot's first treatment, I slept for 4 hours without waking up, which if you've had pain is a long time. And I was just so happy, and I've been looking forward to coming into my treatment every day because I knew that I would feel better. And being in the clinic, I've actually met other patients that are having the same experience. And if you've had pain, when you don't have that excruciating pain anymore, it's amazing. Before seeing Minot, I would say that on a scale of 1 to 10, every day for almost 3 weeks, I was between a 9 and an 11. After my first treatment, I went down to, I'd say, about a 6. And this is just after my treatment. I didn't have any more muscle spasms, and I've been sleeping a little bit more every night. And I've just had my second treatment. I'm totally excited about what's going to happen. And I was lucky because I had two women that I respected and knew that recommended me, but I'm really grateful to the first person that Minot saw that didn't maybe have a good friend that could recommend, that took that chance and has been recommending, and that person's paid it forward. So um, it's been amazing. So if you're in doubt, honestly just try it because it's life-changing to not feel pain.
So you can see in this patient, and this is a common example, obviously pain was the number one thing that had to happen. But her understanding now that her body can heal, that this is all possible, she describes it as a life-changing um, event. And at this point, any other further needs she may have will be so easy to address. One, because she now trusts in her body to be able to heal. And also, she's prepared for it because we've cleaned the slate. We've gotten rid of the pain and we've got all the systems rebooting. So if you want more information, feel free to contact info@bowencollege.com or to call 1-866-DO-BOWEN, and we'll be happy to answer any other questions on any level. Okay, thank you so much.